Did you know that there's a deadly disease silently hiding inside the bodies of tens of thousands of seniors? One that takes more lives each year than breast cancer. Yet most people have never even talked to their doctor about it? That's not just alarming. It's terrifying. Especially because this disease often begins with subtle, almost invisible symptoms. It creeps in quietly, hiding behind everyday aches, strange digestive changes, or harmless fatigue, until it's too late. I'm talking about pancreatic cancer, one of the most lethal and elusive cancers affecting people over the age of 60 in the United States. If you're over 60 or love someone who is, you need to hear what I'm about to tell you. Because by the end of this video, you'll know the critical early warning signs of pancreatic cancer that most people completely overlook, sometimes for months. Here's the grim truth. Pancreatic cancer has one of the lowest survival rates of any major cancer. Only about 11% of patients are still alive 5 years after being diagnosed. And it's not because doctors can't treat it. It's because, in most cases, it isn't caught until it's already advanced, often when it's too late to intervene. Over 60,000 Americans are diagnosed with this aggressive disease every year. But what's even more tragic is that 3 out of 4 of them didn't know something was wrong until it had already spread. That means they likely had early warning signs. They just didn't recognize them. Maybe they chalked it up to aging. Maybe they were too busy. Or maybe, like many people over 60, they just assumed it was something they could wait out. But this disease doesn't wait. What makes pancreatic cancer so sneaky is the location of the pancreas itself. It's a small, hand-sized organ nestled deep in your abdomen, behind your stomach. Its job is vital. It helps digest your food and regulates blood sugar. But its hidden location also makes it difficult to examine, and even harder to detect early tumors. That's why knowing the early warning signs yourself could be the difference between life and death. You don't need to be a doctor to recognize when your body is sending distress signals. You just need to be aware and take action when something feels wrong. Let's start with something most people wouldn't even think twice about: the color of your urine. If you've noticed your urine becoming unusually dark, like the color of cola or strong tea, even though you're drinking enough fluids, it might be your body warning you about a serious bile duct blockage caused by pancreatic cancer. When the bile duct is blocked, bilirubin, a yellow compound your body usually flushes out, builds up inside you. This often leads to jaundice, but before your skin or eyes turn yellow, it starts changing your urine. It's easy to dismiss this as dehydration or a vitamin side effect. But if it persists for more than a couple of days, it could be a critical early sign. Next, imagine a nagging pain in your upper abdomen. Not a sharp pain, but a deep, aching one that sometimes wraps around to your back. This kind of discomfort can appear when a tumor forms in the body or tail of the pancreas. It might seem like back strain or indigestion at first, but unlike a pulled muscle or gas pain, it doesn't go away. It often gets worse after meals or when you lie down. Some seniors describe it as a dull pressure. Others feel it as a heavy, gnawing sensation that just won't leave. This type of pain pattern is distinct, and if you're experiencing it consistently, especially if it's paired with other symptoms we'll discuss, don't ignore it. Bloating and unusual fullness after eating can also be a sign that your pancreas is under attack. Many older adults feel bloated from time to time, but if you're suddenly feeling full after just a few bites, it might be more than indigestion. This is called early satiety. When a tumor presses on your stomach or affects how your digestive enzymes function, it can make you feel bloated even if you haven't eaten much. If antacids and light meals aren't helping, and you're feeling this persistent pressure or fullness day after day, your pancreas might be struggling to keep up. You should also pay close attention to your liver and gallbladder, even though you may not be able to feel them directly. If pancreatic cancer starts to block the bile duct, bile can back up into these neighboring organs. The gallbladder, which is usually about the size of a small pear, can swell up, and the liver can become enlarged. Sometimes, your doctor can detect this swelling during a routine physical exam. Other times, it might show up in scans you get for seemingly unrelated issues. If your doctor ever mentions an enlarged liver or gallbladder, ask them to check your pancreas too. It could be more than a random inflammation. It could be a crucial piece of the puzzle. Then there are the blood clots. Yes, pancreatic cancer can actually cause your blood to clot more easily. This condition, called hypercoagulability, can lead to deep vein thrombosis, DVT, which is when clots form in the deep veins of your legs. If you notice swelling, warmth, or redness in your calf or thigh, don't assume it's a pulled muscle or poor circulation. A clot can travel to your lungs and cause a deadly pulmonary embolism. This happens far too often in seniors, especially those already living a more sedentary lifestyle. If you suddenly feel short of breath, experience chest pain when breathing, or notice your heart racing without reason, you need emergency care immediately. What about fever and chills? While you might assume those mean you've caught a cold or flu, repeated episodes of unexplained fever and shivering, especially when paired with other symptoms, can indicate pancreatic inflammation or infection. The cancer triggers immune responses in your body, making your temperature spike and crash in confusing cycles. 1 minute you're freezing, the next you're burning up. These waves of fever often come with night sweats and an overall sense of being unwell. Unlike a typical infection, they don't go away after a few days. If you find yourself experiencing unexplained temperature swings for more than a week, talk to your doctor about it. Fatigue is another big one. And this isn't your everyday, "I didn't sleep well" kind of tired. This is a deep, bone-level exhaustion that lingers no matter how much you rest. You might wake up tired, need naps during the day, and still feel drained. Pancreatic cancer drains your body's energy by using up nutrients your healthy cells need. Over time, it can make daily activities, like walking, shopping, or cleaning, feel like running a marathon. If you're also experiencing emotional changes, like depression or anxiety, this combo could be your body's desperate cry for help. Many seniors blame fatigue on age, medications, or poor sleep. But when this kind of exhaustion does... Lastly, digestive problems. Not the occasional stomach upset, but chronic, persistent issues. Your pancreas produces enzymes that help break down fats, proteins, and carbs. When it's compromised by cancer, your digestion goes haywire. You might feel nauseated, vomit after meals, or have consistent discomfort in your stomach. Worse, your stools may change, becoming pale, greasy, or unusually foul-smelling. This happens when your body can't properly digest fats. These signs, while unpleasant, are actually critical clues. They mean your pancreas isn't doing its job, and if it's not due to pancreatitis or gallstones, cancer must be considered. Look, I know this may sound scary, but awareness is your first line of defense. You now know 8 symptoms that, on their own, may seem harmless, but together, they could be pointing to something serious. And here's what's even more encouraging. Researchers at Johns Hopkins have found that recognizing just 3 of these symptoms together can improve early detection rates by nearly 70%. That's huge. That means the earlier you act, the better your chances. If you or someone you love is experiencing several of these signs, especially if they persist for more than a couple of weeks. It's time to have a serious conversation with a doctor. Please don't wait. Time matters. Pancreatic cancer may be stealthy, but with knowledge, we can fight back. If you found this video helpful or eye-opening, share it with someone you care about. You never know whose life it might save. And if you'd like more critical health updates tailored for the 60+ community, hit the like button and subscribe. Our mission is to keep you informed, empowered, and healthier, because every senior deserves a fighting chance.